Welcome to Bestmed Medical Scheme presentation on updates for 2023. This video highlights and summarizes the various options available on Bestmed with reference to the changes in benefits and contributions for 2023. NMG is an authorized financial services provider. NMG staff are fully accredited with the FSCA, the Council for Medical Schemes, and your medical aid. As one of the largest financial services intermediaries in South Africa with more than 30 years of experience, we can assist with various elements of your medical scheme and provide you with the independent advice on the most appropriate option. Let's take a look at the benefit updates for next year. Bestmed announced an 8.5% average increase across their plans for 2023. Most of the plans will have an 8.9% increase. To align the contribution difference between Beat 2 and Beat 3 plan, from 2023, the Beat 3 plans will have a lower contribution increase compared to the rest of the plans and a reduction in contributions for child dependents to make it easier for members to upgrade from Beat 2 to Beat 3. An overview of the benefit changes includes the following: enhancements on the Beat range, benefit changes on Beat 3, future changes, introduction of a new option, enhancements on the pace range, enhancements on the rhythm range, changes to limits and sublimits, Tempo Wellness Program, and contributions for 2023. We will now be unpacking these benefits in a bit more detail. Beat range enhancements. Dental and oral surgeries were previously not covered on Beat 2. From 2023, these procedures will be funded from the available medical savings account, with the exception for children below the age of 7, where a separate limit of 5,782 Rand per family is covered from the risk benefit. A new benefit for artificial discs has been added and will be paid from the spinal internal prosthesis limit on all Beat range plans. Previously, there was no benefit for artificial discs. The internal prosthesis sublimits increased on all Beat options. The vascular limit increased on average by 68%, and the functional prosthesis limit increased on average by 108%. The funding of the insertion, consultation and procedure by a family practitioner or gynecologist of intrauterine devices will be funded from the preventative care benefit on the Beat 4 option once every 5 years. Changes to Beat 3. The lower contribution increases and reduction in child contributions on Beat 3 plans will result in the following benefit changes on the plans. The medical savings account allocation has been reduced from 16% to 15%. The optometry benefit currently paid from the risk benefit will now be paid from the available medical savings account. To fill the gap between Beat 3 and Beat 4, an introduction of the Beat 3 Plus option is anticipated to be launched in April 2023 once approved by the Council of Medical Schemes. Enhancements on the PACE range. PACE 2 and PACE 3 updated overall day-to-day limits, sublimits for orthodontics, hearing aids, supplementary services, and wound care. The limits for non-chronic disease list conditions and acute medicine benefits have also been updated. Artificial discs will be paid from the spinal internal prosthesis limit on all PACE options. The funding of the insertion, consultation and procedure of an IUD will be funded from the preventative care benefit on all PACE options once every 5 years. The consultation was previously paid from available day-to-day benefits. Rhythm range enhancements. Income brackets were removed on Rhythm 2 and the contributions have been updated. Artificial discs will be paid from spinal internal prosthesis limit on Rhythm 2. The internal prosthesis sublimits increased on all rhythm options. The vascular limit increased on average by 82% and the functional prosthesis limit increased on average by 164%. A list of 9 elective or non-prescribed minimum benefit procedures in a day clinic or family practitioner rooms were added to Rhythm 1, limited to 50,000 Rand per family per annum. These procedures include breast biopsy, circumcision, colonoscopy, dilatation and curettage, DNC, female sterilization, gastroscopy, grommet insertion and myringotomy, male sterilization and tonsillectomy. All limits and sublimits were increased by 5.7% across all benefit options. Now that we've gone through the changes for next year, let's move on to an overview of the 3 components of your medical scheme: hospital cover, chronic cover, and day-to-day cover. Hospital cover is the most important element of your medical scheme. Hospitalization is unlimited on all Bestmed options. This rate is reflected as a percentage of the scheme rate and all Bestmed options cover members up to 100% of the Bestmed rate. Planned hospital procedures need to be pre-authorized with Bestmed by contacting the number on your membership card. Your doctor may do this on your behalf or may give you the necessary codes and descriptions to obtain the authorization yourself. Members on certain plans may need to make use of network hospitals in the case of planned procedures. In the case of an emergency event, members must go straight to the closest hospital. It is recommended that members always carry their membership cards with them. It is becoming more important each year to consider taking out gap cover. Gap cover is a short-term insurance product which can be purchased separately from your medical scheme and is an effective way to ensure that you are covered for hospital shortfalls. These shortfalls arise because there is no forced regulation on provider charges. Medical schemes may only cover up to a certain Rand value, or your medical aid has co-payments and deductibles. Gap cover will assist in covering the resultant in-hospital shortfalls. Let's move on to your chronic cover. All plans cover for medication relating to 27 chronic conditions which are paid from risk. Certain plans have an additional list of chronic conditions that will be covered, so it is important to understand this before you consider a plan change. By example, higher costing plans include cover for certain mental illnesses such as depression. A plan downgrade will result in the member having to pay for this medication from day-to-day benefits instead of the chronic benefit. Should your doctor diagnose you with one of these chronic conditions, they will need to complete a chronic application form and submit this to your medical scheme. This will ensure that your treatment and medication relating to the condition is covered by the scheme and will not affect your day-to-day benefits. Each plan has a chronic medication list known as a formulary list to guide members on which medications are available on their plan. If you choose a medication that is not on the formulary, a co-payment will apply. Chat to your doctor about the possibility of changing to a formulary medicine to avoid this shortfall. Bestmed members also have access to preventative care benefits that entitles you to a number of screenings, preventative tests, and vaccines. Let us discuss day-to-day benefits. Bestmed offers a variety of options to meet members' different needs. The majority of Bestmed options are known as hybrid options, which offer members cover for day-to-day in the form of a savings account and additional day-to-day benefits up to certain limits. There are pure savings options which cover for day-to-day expenses from an allocated savings account and preventative dentistry from the preventative care benefit. Hospital plans which do not cover for any day-to-day cover, and lastly, network plans which provide cover via network providers up to certain limits, and the contribution is based on income on the Rhythm 1 plan. Bestmed's maternity care program is available on all plans and include the following benefits: antenatal consultations, postnatal consultations depending on the plan selected, 2 2D scans, antenatal supplements limited to 127 Rand per claim once a month for a maximum of 9 months depending on the plan selected, access to a 24-hour medical advice line, weekly emails with helpful tips about the pregnancy and baby developments. Partners will also receive emails about baby developments and mom's progress. Separate monitoring program for high-risk patients and psychologist or counseling should the pregnancy be unsuccessful. Now that you have a better understanding of the key components of your medical scheme, let's take a closer look at the options that are available. Here we provide a high-level summary of the PACE and BEAT series with reference to the type of day-to-day cover, chronic cover, as well as principal member contributions. The BEAT series separates the contributions between non-network and network options. It is important to speak to a consultant to understand if the hospital networks would be suitable for you and your family before making any decisions. The Rhythm series is a cost-effective network-based option. Income bands apply to the Rhythm 1 plan. The Rhythm option includes the following benefits accessed through network providers: unlimited GP consultations, basic dentistry, basic optometry, specialist benefit, maternity and casualty benefits, prescribed medication, as well as a limited over-the-counter medication benefit. Provided members stay within the network, these plans can be very attractive in terms of benefits and costs. Medical schemes often negotiate reduced rates with certain hospitals, allowing them to charge members less. These networks may be suitable for certain members depending on their location. It is important to note that members can use any hospital in the case of an emergency. However, if it is not an emergency, then a co-payment will apply. Let's take a look at an overview of the contributions. Below, we provide a summary of the PACE and BEAT series contributions for principal member, spouse, and children. The Rhythm series is also summarized by principal member, spouse, and children. However, is further separated by income, providing the contribution per income category. Bestmed offer a comprehensive wellness program for all members, which we will now review. The Bestmed Tempo Wellness Program offers a variety of benefits. biometric screening at a network pharmacy clinic, on-site at an employer, or by a qualified tempo biokineticist. Assessments are covered from the preventative care benefit. A nutritional assessment and personalized diet development and one follow-up consultation with a tempo dietitian for beneficiaries 16 years and older. One fitness test and one follow-up in-person or virtual consultation at a tempo biokineticist for beneficiaries 16 years and older. New emotional wellness benefit developed by qualified psychologists and healthcare providers to identify mental health care needs, which include access to lifestyle-related information, practical challenges, and connecting members to a mental health practitioner in the Bestmed network. The consultation will be paid from the medical savings account or day-to-day benefits. The Bestmed Tempo Wellness Program is focused on supporting members on their journeys to improving their health and realizing the rewards that come with it. The Tempo app will allow members to track their physical activity, access virtual events, and information relating to nutrition, emotional well-being, and preventative care benefits. Where to from here? Should you like to make a change to your option, you can either contact your NMG consultant or use the NMG portal. The NMG portal is an online platform used by most of our corporate clients, which allows members to view their personal information, make changes to their options, compare rates and benefits, to name just a few. This is all done with the highest level of security to ensure your information is kept safe. Kindly note our complaints procedure should you not have been fully satisfied with any information in this presentation. Should you like to speak to a consultant for more information, please contact us at one of our branches. Thanks for your time. Take care.